Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having some trouble with my breathing lately. It started off as just a bit of wheezing, especially after exercise or when I'm climbing stairs. More recently, it's even been affecting me during sex, which is quite distressing. I was given a pink inhaler to use twice a day, but honestly, sometimes I forget to take it or skip it if I'm feeling okay.
I see. How long have you been experiencing these symptoms before you started using the inhaler?
It's been a few months. The symptoms gradually got worse, and that's when I went to see my doctor about it. They suggested the inhaler after a brief checkup, but we didn't do any detailed tests at that time.
Okay, and have there been any changes or improvements since you started using the inhaler?
A bit, I guess. When I remember to take it regularly, I don't wheeze as much. But there's still this general feeling of not being able to catch my breath sometimes, especially during physical activity.
You mentioned a failed pulmonary function test. Can you tell me more about what happened during that test?
Yes, that was quite scary, actually. I was supposed to do several breathing exercises, but midway through, I just blacked out. They had to stop the test. It was at St. Alexis, and they mentioned wanting to redo the test, but perhaps with some precautions or a different approach.
Understood. Let's shift focus for a moment to your other symptoms. You mentioned occasional pain from a previous rotator cuff repair and ongoing back pain. Can you elaborate on those issues?
Sure. The shoulder mostly bothers me if I'm lifting something heavy or doing certain exercises. It's manageable. I don't take any pain medication for it. The back pain, though, that's more frequent. It's usually a sharp pain when I bend or lift anything. I take ibuprofen occasionally when it gets bad, about 5 to 6 days a week.
Has there been any investigation into the cause of your back pain, such as recent imaging or tests?
I had an MRI back in 2007 because I was experiencing numbness in my legs along with the pain. They told me it was a strained back, but nothing significant that required surgery or anything. It's mostly just managing the pain as it comes.
I see. And how about your bowel movements? You noted a change there as well.
Yes, it's not something I was initially worried about, but I've noticed I'm going less frequently. It used to be 2 or 3 times a day, and now it's down to once, without any significant pain, just less frequent.
Thank you for sharing all of that. It helps to get a full picture. Let's discuss your lifestyle a bit. Can you tell me about your alcohol intake, smoking, and exercise habits?
I don't smoke at all. I used to drink a bit more, but I've cut down to about 2 drinks a week. As for exercise, I've really had to cut back because of the asthma and the back pain. It's frustrating because I want to stay active, especially since I'm training to be an auto technician, which can be physically demanding.
It's good that you're making an effort to manage your lifestyle factors. Now let's summarize and plan our next steps. Your vital signs today are stable. Blood pressure is a bit high at 140/93 mm Hg. Your recent lab results, including CBC and CMP, are within normal limits, which is reassuring. The chest X-ray showed clear lungs, and your EKG was normal.
What do you suggest we do next?
First, we should address your asthma. Since there's variability in your symptoms and inhaler use, and given the blackout during your test, a repeat pulmonary function test is crucial. We'll do it with proper precautions to avoid another blackout. Depending on those results, we may adjust your inhaler treatment or explore additional therapies. For your musculoskeletal pain, monitoring and managing with ibuprofen, as you've been doing, is reasonable. However, if the pain increases or becomes more frequent, we should reevaluate you, possibly with more imaging or a referral to a specialist. Considering your change in bowel habits and age, I recommend scheduling a colonoscopy as you approach 50. It's a good preventive measure given your past health history. Finally, it might be beneficial to consult with a physical therapist or a fitness specialist who can help design an exercise program that accommodates your asthma and back issues, ensuring you can stay active without exacerbating your symptoms.
Thank you, doctor. I appreciate the thorough plan and feel more informed about what we need to do moving forward.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling overwhelmed with all the medication changes over the years. Every time I see a different doctor, there seems to be a new suggestion or alteration to my regimen. It's confusing and a bit frustrating. I used to be on different dosages, and sometimes they added new medications without much explanation.
I understand that it can be very confusing. Let's try to make things clearer today. Tell me more about your experiences with these changes. How have you felt physically and emotionally with the adjustments?
Physically, there are days I feel okay, but there are many days when I just don't feel right. My blood pressure still doesn't seem to stabilize. It's up and down. Last year, one doctor increased my lisinopril, then another one added amlodipine. It's a lot to keep track of, and with my gout, the flare-ups are painful, and sometimes I'm not sure if it's the medications affecting that too.
It's important for us to consider both your physical symptoms and how you're coping with the treatment plan. Let's talk a bit more about your daily routines and how these medications are fitting into your lifestyle.
Well, I try to stay active, walking every day like you suggested. I've also tried to cut down on salts and sugars, though it's tough. I'm cutting my thiazide pills in half as per the last instructions. With the gout, I take indomethacin when it flares up, but I've been wondering if there's something more preventive I could do.
That's good to hear that you're making these lifestyle changes. They're very important for managing your conditions. Regarding your gout, a preventive approach might indeed be beneficial for you. We'll discuss that today as well. How has your mood been with all these health concerns?
It's stressful, to be honest. Managing all these meds and keeping up with doctor appointments while worrying about my health, it takes a toll. I feel anxious a lot, wondering if I'm doing the right things or if I need to do more.
Thank you for sharing that. Managing chronic conditions can certainly be challenging, not just physically, but also emotionally. Now let's review your recent lab results and see how we can streamline your treatment to better support you. Your blood pressure today was initially 156/90, which we brought down to 148/85 on the second measurement. Your pulse is stable at 72, and your respiratory rate is normal at 16 breaths per minute. Your body temperature is also normal.
Okay, that sounds a bit better than I feared, but I'm still concerned about the fluctuations in my blood pressure.
Understandably so. Your lab results show a slight elevation in creatinine at 1.4 milligrams per deciliter and the presence of trace proteins in your urine, which suggests that we need to keep an eye on your kidney function. Your hemoglobin A1C is 5.9%, which is good as it indicates you're managing your prediabetes well, but it's something we need to continue monitoring. Your cholesterol levels are within a manageable range, but we can discuss optimizing that further.
What do you suggest we do moving forward?
Here's the plan. I'd like to simplify your medication regimen where possible and make sure it's effective. We'll increase your thiazide from 12.5 milligrams to the full 25 milligrams daily. This should help better control your blood pressure. We'll continue with lisinopril and amlodipine as they are. For your gout, considering your concerns about flare-ups, we should discuss starting a preventive medication. This could potentially reduce the frequency and severity of the flare-ups.
That sounds like a solid plan. I hope this can bring some stability.
I believe it will help. I want you to continue your physical activities and dietary adjustments. Also, keep a log of your blood pressure readings at home for the next 2 weeks and bring it to your next visit. We'll review it together to see how the new regimen is working. We'll also follow up in a month to reevaluate your blood pressure and then annually for a routine checkup unless issues arise sooner. Lastly, don't forget to get your flu shot today and consider scheduling a colonoscopy, as it's recommended for your age group.
Thank you, doctor. I appreciate you helping make sense of all this. I'll follow the plan and keep you updated with the log.
You're welcome. It's important that we work together on this. I'm here to support you in managing your health effectively. See you in a month, and don't hesitate to call if you have any questions or concerns in the meantime.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So this is your new insulin pump. It's going to help you manage your diabetes more effectively by delivering insulin directly into your bloodstream. Let's start by showing you how to fill the reservoir and set your basal rate.
What happens if I get an error message on the screen?
Great question. Each error message has specific guidelines, which are detailed in your user manual. Generally, you'll need to check the tubing for blockages or air bubbles and ensure the reservoir isn't empty. If the problem persists, you should contact the support team.
And what if it stops delivering insulin?
If that happens, first check to see if the battery is charged. If it's fine, then make sure the infusion set is properly connected. If everything seems correct, it might be necessary to replace the set or reset the pump.
Now look at question 26.
I've reviewed your latest scans, and I need to discuss the results with you. It appears that the treatment isn't having the desired effect on your cancer.
But I feel fine. Are you sure the scans are mine?
Yes, I've double-checked. It's important we address this now. Despite feeling okay, the scans show that the cancer has progressed.
That can't be right. There must be a mistake.
I understand this is hard to accept. I assure you, our team is here to support you, and there are other treatment options we can explore. It's crucial we discuss these and plan the next steps together.
Now look at question 27.
Today, I'd like to share some strategies for fostering a supportive work environment in our hospital. One key aspect is recognizing the signs of burnout and addressing them early. Another important factor is communication. We need to ensure that our team feels comfortable sharing concerns and that these are addressed constructively. Lastly, promoting teamwork through regular team-building activities can enhance understanding and cooperation among staff. This not only improves patient care, but also creates a more enjoyable work atmosphere.
Now look at question 28.
Managing pain in patients with sickle cell disease requires a collaborative approach. Acute pain crises are complex and need immediate and effective intervention.
Absolutely. For chronic pain, we should consider both pharmacological treatments and non-pharmacological methods. What's your experience with using TENS units in these patients?
TENS units can be effective, especially when combined with pain medications. We also need to focus on patient education, helping them understand their pain management plan.
That's a good point. Ensuring they are involved in their treatment decisions can really empower them and potentially improve outcomes.
Now look at question 29.
I understand that this diagnosis of diabetes for your child can be overwhelming. It's important to focus on managing the condition through a healthy diet, regular exercise, and proper medication.
How do we make sure we're giving him the right amount of insulin?
We'll start with a standard dose based on his weight and monitor his blood sugar levels closely. Adjustments will be made based on his response and daily blood sugar logs.
Education is key. You both will learn how to recognize signs of high or low blood sugar and how to handle them. Support groups and resources are also available for your family.
Now look at question 30.
When taking multiple medications, it's crucial to monitor for potential drug interactions, which can affect how your treatments work or increase side effects.
What should I look out for?
Look for any new symptoms like dizziness, a rash, or unusual fatigue. If you start a new medication, even over-the-counter drugs or supplements, let me know. It's also helpful to keep a list of all your medications and review them with your healthcare providers regularly. This way, we can make safe adjustments as needed.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Good afternoon, everyone. Today, I'm excited to delve into a complex and often underappreciated topic in the management of restless leg syndrome, RLS, particularly focusing on the use of intravenous iron therapy. Our discussion will be grounded in recent scholarly research, including a case study that illustrates the practical challenges and successes of this approach.
Thank you. It's certainly a topic that's gaining traction among sleep medicine specialists, given the intricate relationship between iron metabolism and neurological disorders. Could you begin by explaining why iron is so crucial in RLS?
Absolutely. Iron plays a pivotal role in the brain's dopaminergic system, which is integral to movement regulation. Research such as that from Harvard's neurology departments suggests that iron deficiency in the brain disrupts dopamine pathways, potentially exacerbating or even triggering RLS symptoms. This is why assessing and correcting iron levels is paramount in managing RLS effectively.
That brings us to the methods of assessing iron levels in patients with RLS. Could you elaborate on the recommended protocols?
Certainly. The initial step involves a thorough clinical assessment for iron deficiency, including history of gastrointestinal blood loss, menorrhagia in premenopausal women, and frequent blood donation. Despite these assessments, many patients might not show overt signs of iron deficiency, which is why we proceed with blood tests. These include serum ferritin, serum iron, and total iron binding capacity to calculate percentage saturation. It's critical that patients cease any iron supplementation a few days before testing to avoid skewed results.
And what constitutes normal levels in these tests?
Normal values can vary based on the methods used by the lab. At Mayo Clinic, for instance, we transitioned from the Beckman to the Roche method, significantly altering the normal ranges for serum ferritin. Previously, we aimed for 50 to 75 micrograms per liter, but with the Roche method, the new normal is between 80 to 120 micrograms per liter. It underscores the importance of knowing the lab methods and corresponding normal values when interpreting results.
Turning to treatment, when would you consider intravenous iron therapy appropriate?
Intravenous iron is considered when there's a clear deficiency or low normal iron stores, and the patient either cannot tolerate oral iron due to gastrointestinal side effects, or when there's a need for rapid improvement of symptoms. It's particularly useful in severe cases of RLS where rapid symptom control is crucial. The choice of iron preparation is also vital, with options like low molecular weight iron dextran and ferric carboxymaltose being preferred due to their favorable pharmacokinetic profiles.
Can you share a case study that illustrates the successful integration of these practices?
Certainly. We had a patient, a 45-year-old female with severe RLS, who had been on high-dose dopamine agonists with significant augmentation. Her serum ferritin was 35 micrograms per liter using the Roche method, and her symptoms were debilitating. Given her history of intolerance to oral iron, we initiated intravenous ferric carboxymaltose. We administered 750 milligrams in 2 doses 2 weeks apart. The patient reported a substantial decrease in RLS symptoms within a month, and follow-up tests showed her ferritin levels had improved to within the normal range. This case highlights the potential for IV iron to dramatically improve quality of life in properly selected patients.
That's a compelling example. Any final thoughts on the broader implications for clinical practice?
Yes, the key takeaway is the importance of tailored treatment strategies in RLS management. Understanding individual patient profiles, the nuances of laboratory measurements, and the judicious use of advanced therapies like IV iron can significantly enhance outcomes. It also emphasizes the need for ongoing research and education to refine our approaches continually.
Thank you for those insights. It's clear that managing RLS, particularly with IV iron, requires a nuanced understanding of both the disorder and the treatments available. It's an area where specialized care can make a significant difference in patient outcomes.
Indeed. Thank you all for joining today's session. We hope this discussion enriches your clinical practice and supports your ongoing efforts to manage complex cases of RLS effectively.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. I am Dr. Elaine Thompson, a clinical psychologist specializing in chronic health issues. And today I'll be discussing integrating cognitive behavioral strategies can significantly improve the quality of life for those living with chronic conditions. Our focus will be on a case study that illustrates the effectiveness of these strategies in a real-world scenario. In recent years, the integration of cognitive behavioral therapy, CBT, into the management of chronic illnesses has garnered increasing attention. According to a study published in the Harvard Review of Psychiatry, CBT provides a robust framework for addressing the psychological components of chronic diseases, such as pain management, coping with the limitations caused by illness, and improving overall mental health. Today, we will examine the case of a patient referred to as Tom. Tom, a 54-year-old male with chronic obstructive pulmonary disease, COPD, and associated chronic pain, initially presented with symptoms of depression and significant anxiety related to his health. His situation is not uncommon. Individuals with chronic illnesses often experience a cyclical pattern of emotional distress, physical symptoms exacerbation, and reduced participation in life activities. Our approach with Tom was multifaceted. Firstly, we focused on cognitive restructuring, a core component of CBT. This involved identifying and challenging his negative thought patterns about his illness and capabilities. For instance, Tom often said, "I can't manage even simple tasks anymore." Through guided discovery, we explored evidence against this belief and introduced more balanced thoughts, such as, "I need to pace myself and take breaks, but I can manage several tasks with proper planning." Another key technique we utilized was behavioral activation. Tom had gradually stopped doing activities he enjoyed because he feared they would exacerbate his symptoms. We developed a graduated plan that included mild physical activities, like walking and light gardening, which were once sources of joy for Tom. The gradual reintroduction of these activities not only improved his physical stamina, but also boosted his mood. Furthermore, relaxation techniques and stress management were taught to help Tom cope with episodes of pain and anxiety. We regularly practiced diaphragmatic breathing and progressive muscle relaxation, which helped reduce his physical symptoms of stress, such as increased heart rate and rapid breathing, which are particularly problematic for COPD patients. A pivotal part of our sessions also included education about sleep hygiene practices, as poor sleep can exacerbate pain, anxiety, and depression. Tom was encouraged to establish a regular sleep schedule, limit his caffeine intake, and create a bedtime routine that promoted relaxation, which included reading and listening to calming music. Lastly, we addressed Tom's social withdrawal. Chronic illness can lead to isolation, which exacerbates depressive symptoms. We worked on communication strategies that Tom could use to express his needs and limitations to friends and family, which helped in setting realistic expectations and re-engaging socially in a manner that his health allowed. The outcome of integrating these CBT techniques was substantial. Over several months, Tom reported a marked improvement in his ability to manage pain and engage in daily activities. More importantly, he noted a significant reduction in his depressive and anxious symptoms, evidenced by his increased participation in social activities and personal projects. The application of cognitive behavioral strategies in chronic illness management can lead to significant improvements in both psychological and physical health. Studies, including those from Harvard, underscore the efficacy of CBT in breaking the cycle of depression and anxiety that often accompanies chronic health issues. For healthcare providers, incorporating these strategies into treatment plans is crucial in offering a holistic approach to managing chronic diseases. Thank you for your attention today. We will now open the floor for questions and discussion.